Thrombosis, the silent enemy that is killing increasingly younger people. Let's talk about something very serious: thrombosis and blood clot formation. This is a topic that should be taught in schools, discussed at home, and taken seriously by people of all ages. For a long time, we thought thrombosis was a problem exclusive to elderly people or those who already had some serious illness. But the reality that medicine is revealing is very different. This condition is appearing earlier and earlier in people's lives, silently, without warning, and in many cases with devastating consequences. Why this subject could save your life today. Can this be prevented? Are there natural measures or foods that help us avoid it? Could red wine help? Let's look in a simple way at what deep vein thrombosis is, why it occurs, who it happens to, and most importantly, what measures we can take at home to prevent it from occurring. Did you know that in your home, in your kitchen, you have a natural pharmacy that helps fight this and improve your circulation? What thrombosis is, and how it destroys your veins from the inside. Thrombosis is a condition in which a thrombus, or clot, forms in one of our blood vessels. To better understand, think of the circulatory system as a network of roads through which blood constantly travels, carrying oxygen and nutrients to every cell in the body. When a clot forms inside one of these roads, it acts as a blockage, preventing traffic from flowing normally. The consequences of this blockage depend directly on where it happens and on the size of the clot formed. Where clots form and what happens to your blood. This generally occurs in the deep veins of the lower limbs, at the level of the calf, knees, thighs, or a little higher up, in the pelvis. That is why it is called deep vein thrombosis, because it occurs in the veins that lie deep within our muscles or organs. The clot restricts blood flow. Blood that should flow upward, leaving the legs, becomes stagnant, meaning it does not drain as it should because it encounters an obstruction.
In that vein, a thrombus has formed that is adhered to the vein wall and often completely occludes that blood vessel. Then all the blood that should be drained begins to accumulate below, and at that point the leg swells. That sensation of heaviness begins. It may hurt a great deal or turn red. Although this is the most common form, thrombosis can occur in any part of the body. When it occurs in the heart, we have a heart attack. If it occurs in the brain, we have a stroke.
There are people who even have thrombosis in the vessels of the arms, the abdomen, near the liver. And depending on where it occurs, you will have the corresponding symptoms. But the two most serious consequences are about to be revealed, and one of them kills more than 100,000 people per year. The two fatal consequences nobody tells you about. The first serious consequence occurs when the thrombus in the leg veins damages the wall of the blood vessel and causes inflammation in the vein. To understand the severity of this, we need to look at how the venous system works under normal conditions. The veins have valves that function like floodgates, allowing blood to flow only upward and preventing it from flowing back due to gravity. These valves are delicate and extremely precise structures that open and close thousands of times a day to ensure that circulation functions properly. But if we have thrombosis at this level, the vein walls become damaged, the valves are compromised, and we begin to suffer from chronic venous insufficiency. At that point, varicose veins or chronic swelling in the lower limb may appear. This is not merely an aesthetic issue. Chronic venous insufficiency represents a progressive deterioration of quality of life, with constant pain, swelling that makes it difficult to wear normal shoes, and a permanent sensation of heaviness in the legs. The embolus that travels through the blood and can kill in minutes. Over time, if this is not treated, it can lead to serious complications at the site where the thrombosis occurred, including the formation of ulcers on the legs. These ulcers are open wounds that take a very long time to heal, are painful, and represent a constant risk of infection. The other problem is far more serious. The thrombus adhered to the vein wall can break off into a fragment, forming an embolus. This embolus can travel through the bloodstream, pass through the heart, and block the vessels of the lungs, causing a serious condition called pulmonary thromboembolism. This is a condition that, sadly, occurs in more than 1 million people per year and kills more than 100,000 people per year. and for some reason it is occurring more and more in younger people. The saddest part is that many of these deaths can be prevented. And that is exactly what you are about to discover. Why your body's imbalance creates deadly clots. One phrase is worth 1,000 words. Thrombosis occurs due to a loss of balance in our organism. The state of balance or harmony in the body is called homeostasis. This balance is maintained by extremely sophisticated systems that work 24 hours a day, 7 days a week, regulating every process within our body, without us having any awareness of it. The clot or thrombus forms when the blood, which should be liquid, becomes semi-solid. That is, in some part of the body the blood has become partially solid and caused an obstruction of blood flow. In your body there are various types of forces in the blood. There are substances that keep the blood liquid and others that are important for forming clots. This ability to form clots is in fact a vital function of the organism. Without it, a simple cut could lead us to death by hemorrhage. The 3 conditions that make your blood turn into an enemy. Blood remains fluid thanks to the balance between these 2 forces. Sometimes, due to different conditions, the organism begins to have an imbalance or alteration of these forces, and at that point, thrombi are produced. Virchow, a German pathologist, described 3 main conditions that favor the formation of thrombi. Damage to blood vessels, a predisposition for these thrombi to form, and slowing of blood flow. A large part of this predisposition is caused by our habits and by what we eat. This means that, to a great extent, we have the power to directly influence this balance through the choices we make every day. But who exactly is at greater risk? The factors you are about to learn may be present in your life without you knowing it. Who is at risk and the signals your body sends before it is too late? The main risk factors are remaining without movement for a long time, such as binge-watching series, taking a long trip, or sitting at work for a long time. Sedentary behavior in general causes immobility and slows blood flow. This is one of the most silent problems of modern life. We spend hours sitting in front of computers, inside cars, in waiting rooms, and rarely think about what this is doing to our circulation. Sitting in the same position for more than 3 or 4 hours, especially with crossed legs, also slows blood flow. Long trips by plane or car lasting more than 3 or 4 hours have the same effect. When we are hospitalized for some reason and remain immobile in bed, especially after orthopedic surgeries such as knee or hip operations, the risk also increases. Another very important risk factor is having chronic inflammation in the body, whether from diabetes, obesity, kidney or heart problems, smoking, cancer, or autoimmune diseases. Using medications such as oral contraceptives, especially if the person smokes, or taking anti-inflammatory drugs also represents a risk factor. The warning symptoms you should never ignore. If you have had an episode of thrombosis and have none of these factors, you probably have some form of thrombophilia, conditions or pathologies that greatly increase the risk of clots, such as genetic diseases that predispose the blood to clot more readily. What must be very clear is that, in the face of a thrombosis episode, we must investigate why it occurred, identify the cause and correct it, because the treatment and prevention of future episodes will depend on this. Warning signs include swelling, a sensation of heaviness, redness generally on only one side of the body, sudden pain in the calf or thigh upon waking, a slight fever, and a feeling of general malaise. A pain that appears in the morning, when you did not even have that symptom the night before, is a sign that deserves immediate attention, especially if you have any of the risk factors mentioned. If the thrombus breaks off and causes pulmonary embolism, you will suddenly feel shortness of breath, chest pain, coughing with or without blood, or a stabbing sensation in the chest when breathing deeply. These are emergency signs that require immediate medical attention, without hesitation. Although in most cases thrombosis occurs in the deeper veins, in some instances it can occur in the superficial veins, visible to the naked eye. At that point, in addition to pain and redness, you will be able to feel what seems like a hardened venous cord beneath the skin. The doctor, in addition to examining you, will order blood tests and a Doppler ultrasound to visualize the thrombus and make the diagnosis. Now that you know the risks, what exactly can you do at home to protect yourself? The answers are closer than you might imagine. What you can do at home to save your own life. Traditional and natural medicine go hand in hand and should not be separated. A good doctor should know how to prescribe medications when necessary, but also be very knowledgeable about which habits, foods, and natural medicines have a very positive impact on people's lives. This integration between scientific knowledge and the natural resources available to each of us is the most complete and effective path to caring for circulatory health. In general, thrombosis is treated with anticoagulants, medications that make the blood more fluid, used for 3 months to a year, sometimes longer, depending on each case. But treatment goes far beyond medication. Identifying and correcting the factors that cause the thrombosis is just as important as the medication itself, because without this step, the risk of new episodes remains high. Simple habits that protect your circulation every day. For prevention, first avoid all the risk factors mentioned. Avoid smoking or smoke less. If you are going to be sitting for a long time or taking a long trip, do not smoke before traveling. If you work sitting down, avoid crossing your legs. Get up every 1 or 2 hours and perform flexion and extension movements of the foot to contract the calves, repeating this movement 10 to 20 times every 2 hours. This simple exercise activates what is called the calf muscle pump, which is one of the most important mechanisms in the body for pushing blood back to the heart. If you have a chronic circulation problem, wear elastic compression stockings throughout the day and remove them at night. On trips, avoid sedative medications for sleeping and avoid alcohol as much as possible. The dehydration caused by alcohol, combined with prolonged immobility, creates very favorable conditions for the formation of clots. Stay up to date with your medical checkups and manage your chronic diseases, as adequate control of conditions such as diabetes, hypertension, and obesity significantly reduces the chronic inflammation that favors thrombosis. And in your kitchen, there are foods that act as powerful natural remedies against clots. You are about to discover which ones they are and how to use them. The natural pharmacy in your kitchen that fights clots. First and foremost, keep your body hydrated. You must drink water. Dehydration is a danger for clot formation because it makes the blood thicker and more viscous, making it harder to circulate through the vessels. Always carry a water bottle with you, especially on trips, at work, and during physical activities. Regarding red wine, many studies have shown that drinking 1 to 2 servings per day, approximately 150 to 300 milliliters, could prevent clot formation. This may seem contradictory to the guidance to avoid alcohol, and in fact it is. What happens is that in reality, it is the antioxidants and active compounds of the grape that help in this process, not the alcohol itself. Therefore, drinking a glass of grape juice, preferably from dark grapes, every day improves circulation without the risks of alcohol. Grapes contain compounds called flavonoids that are also found in other fruits and vegetables. The key is to mix colors. Try to consume at least 3 types of fruits and vegetables of different colors every day. The foods that will thin your blood and shield your veins. Beetroot, eating 1 to 2 per day, improves circulation and has enormous benefits for the rest of the body. It contains natural nitrates that the body converts into substances that help dilate blood vessels and improve flow. You can eat it raw with its skin grated into salads, cooked for a few minutes, or drink its juice unfiltered. Onion of any type, but preferably red onion, which may have more antioxidants, can be consumed raw, lightly cooked, or as an infusion. Pomegranate is the superfruit. Try to consume at least 1 or 2 per week, eating directly from the fruit, chewing and swallowing its seeds, or making unfiltered juice. Garlic is one of the most powerful natural remedies for this. Its secret is that you must crush it before consuming it, allowing its juices to mix in order to activate its component called allicin, which improves circulation and reduces inflammation in the body. Consuming garlic raw and crushed maximizes its therapeutic effects. Avoid foods that cause inflammation. Ultra-processed food, vegetable oils such as sunflower, corn, and soybean, excess sugar, sodas, and processed juices. All of these foods contribute to increasing chronic inflammation in the body, which is one of the main factors that disrupts blood coagulation. The best food is the kind that does not come in packaging. On the other hand, consume good fats, such as those from extra virgin olive oil, avocado, eggs with their yolk, chia seeds, flaxseed, and pumpkin seeds. All of this prevents and combats blood clots. These are the main preventive measures for treating blood clots. Share this information with all your family and friends, because knowledge like this has the power to save lives.